Hi, my name is Casey Barber, and today's question is hip flexor FES, or Functional Electrical Stimulation. So our question is, a 25-year-old female patient with L3 spinal cord injury, Asia Class C, is walking in parallel bars as part of gait training. The physical therapist decides to use FES as part of intervention to work on hip flexor muscle weakness. What are the most appropriate FES parameters for muscle weakness? So this is a basic question. It's really just based on knowledge. There is no reasoning in this. It's just if you know the parameters or not. So the first one is pulse frequency of 35 to 80 pulses per second with a pulse duration of 150 to 350 with an on-off time of 1 to 5. Next one's a pulse frequency of 35 to 50 pulses per second again. Pulse duration of 150 to 350, and an on-off time of 1 to 5. Next one is pulse frequency of 20 to 30 pulses per second, pulse duration of 50 to 100, and on-off time of 1 to 3. And finally, pulse frequency of 20 to 30, pulse duration of 50 to 100, and on-off time of 1 to 3. Okay, so when looking at this, let's take out some of the key parts. So really, there's only one key part. So when looking at this, there's really only one key part, and that is hip flexor muscle weakness, meaning we're going to work on strengthening, so we got to use strengthening parameters. Now, when we look at the parameters for electrical stimulation for strengthening, they are a pulse frequency of 35 to 80 pulses per second, pulse duration of 150 to 200 microseconds for small muscles, and 200 to 350 microseconds for large muscles. So your on-off ratio needs to be a longer time. This is to prevent fatigue, muscle fatigue. So a 1 to 5 would be 10 seconds to 50 seconds. A 1 to 3 would be 15 to 45 seconds. And the longer rest time you have, the less likely you're to have muscle fatigue. And then a total treatment time is 10 to 20 minutes. So I just put that in there. I know that's not in the question, but just wanted to make sure that we know that 10 to 20 minutes is a normal treatment time. So now let's go back to our answers. So really, there's only one that fits the parameters. We have that 35 to 80 pulses per second, as we can see going back, 35 to 80. We want to be between 150 to 350, which means, there we are, between 150 and 350. And then we want an on-off time of 1 to 5. So we have that longer on-off ratio. So by knowing that, we could eliminate C and D, and then we were just going off of who has the correct pulse frequency. Thank you for your time, and have a good day.